tape recorder here to record my sessions. Good evening. My name is Dr. Lancaster Sutherland, half owner of the now Rhodes and Flynn Science and Behavioral Health Therapeutic Clinic and Foundation Building here on Cell Avenue in Canyon City, Colorado, zip code 81212. Wah wah. It is a big building that rivals Sol Vista Health Building on Independence Road. Our founders, J.C. Flynn and Johnny Lee Rhodes, also known as Jonathan Rhodes or John Rhodes or whatever, have invested and bought the building and given the building in possession to us, myself, Dr. Lancaster Sutherland, a noted psychiatrist and doctor. I got my MD at the University of Banana Pea in Mississippi at Mississippi State, which could be the UPB at MSU. Whoa, money, business, whoa, money. Anyway, I am a noted doctor and have a damn good one, I am, in which I will prove with my sessions and let my talent speak for me. Whoa. My patient, who will be referred as patient X, is complaining of a migraine headache. It is my professional belief that he has a tumor. I have ordered X-rays and ultrasounds if necessary. We will operate on the tumor. He turned... All right, patient X, alias Mr. Messervy. The X-ray machine is here, so we will now see what kind of tumor you have. Whoa. Let me turn it on here. Okay. Unfortunately, the X-ray does not reveal anything that is to be a tumor, so I will shut this off. Let me turn it off here. Whoa. Let's get the ultrasound going. It's a good thing Mr. Ingrid isn't here. He is another one I would like to operate on. Let's see here. Well, the ultrasound machine does not indicate a tumor, so we will have to take drastic measures. Nurse, prepare the patient for surgery. We will open up his head and find the tumor in his brain by exploratory surgery. What is your name, nurse? Lippenreader, sir. I see. Well, nurse Lippenreader, prepare patient X for surgery. Okay. I see you're giving him 5 cc's of Stokeline. Nurse Lippenreader, now that he is out, what we are going to do is cut open his cranium around the hairlines. It would be wise if you could set up one of Dr. Fish's industrial buckets near the head area. What are you going to use to cut open his head, doctor? I am going to use an industrial circular saw that is handheld. Doctor, isn't that dangerous? You're not here to remind me what is dangerous or safe, Nurse Lippenreader. You're here to assist me now. Do I need to ask for a new nurse? Or are you going to assist me? Yes, doctor. I'll assist. All right, let's cut open the patient's head here. Now I am now cutting the victim's, the patient's head. I almost have it wide open on the bucket. The bucket is in place to catch any blood and filth that leaks from his body, and we will examine his brain, and we will have approximately 3 minutes to examine it before his body starts to die. So we will have it back in and functioning within 2 minutes. Oh, whoops. Looks like the cranium popped off and the brain slipped out. Well, it's in the bucket now. Look at all that blood. Whoops. His brain slipped. It's there with the muck. It's stuck to the patient's cranium. No problem. We could just scoop it out with a watermelon spoon. Let me get it. Okay, I got the brain here. Let me get the cranium out. Good thing I brought my watermelon scoop. Okay. Oh, whoops. I dropped it on the floor. It's all right. 5-second rule can apply to brains. Let me pick it up here and look at it. I see no tumor. He must have had just a regular migraine.
Doctor, the patient, he's losing too much blood.
Quickly, nurse. Set up an IV and pump the blood back in.
That won't work, doctor. The IV will move too slow.
Then I must do what I must do. Oh, crap. I dropped the brain again. Well, that's all right. It'll help loosen up any plaque that's in the arteries in there. All righty. Let me grab my samurai sword.
Doctor, the sword is not practical.
Nurse Lippenreader, you're about to become just Miss Lippenreader if you don't shut your lip.
Yes, doctor.
Let me slice open the patient's belly. There we go. I'm going to pour the blood back in. Oh, crap. It's spilling back on the floor because his head is cut open. Whoops. Let me put the brain back in first. Nurse, get me the stapler. And where's the brain?
On the floor, doctor.
Ah, yes, I see it. Well, pick it up for me.
Okay, I've got it.
Here. Thank you. All right, I'm going to put it in. Put the brain back in here. I'll staple it shut here. All right, nurse. The head is put back together. It's as easy as building with Legos. Now, nurse, let's pour the blood back in. Let me pour it back in here. Looks like the patient's heart stopped. He's flatlining there. Quick, nurse. The device to restart his heart.
You mean the defibrillator?
Yes, that's it. What? Let me shock the patient here. Nothing. Let me grab this phone here. Hello, this is Dr. Lancaster Sutherland. Yes, it happened again. Yes, I did all I could. All right, could you have the meat wagon here soon? All right, thank you, sir. Goodbye. Let me just speak into my recorder here. Well, it was not a tumor, as I diagnosed. Unfortunately, patient X did not live, and I am not at fault. I did all I could to revive him. Nurse Lippenreader, why don't you inform his family and see that all honors is presented. Once again, this is not my fault. I'm a good doctor. Sometimes this crap happens, and well, they'll just have to deal with it. I'm the greatest doctor in the world, there's no doubt.